Hi, welcome to our presentation about care needs for patients with vascular cognitive impairment and their informal caregivers. My name is Sara from the SCHRAAF and I'm here on behalf of the research team. So vascular cognitive impairment does need special care. Well, we think that it's important for all patients with cognitive disorders and their informal caregivers to receive optimal care. But we think that most care nowadays is tailored towards Alzheimer's disease, and we don't really know if there are special care needs for VCI patients. So that's what we wanted to find out in this study. So we did 18 interviews with 9 patients and 9 informal caregivers. We coded these interviews and we did a thematic analysis according to Brown and Clark. And then we derived 5 themes from this at this point. So we'll list them here. The first theme is the importance of the image of VCI. The second theme is a patient theme about keeping everything as is. The third theme is a caregiver theme and their need to be unburdened by professionals. The fourth theme is the patient behavior influencing caregiver burden and care acceptance as well. And the fifth theme is informal networks diminishing care needs. So the image of VCI, this was mostly about patients and caregivers wanting to know what exactly the condition was and needing more information on this, but also about professionals needing to know what condition they were dealing with. So one caregiver said, everything takes a lot more effort with the patients, but well, I don't know if that's due to the TIA or if it's just the case with everyone our age. So the second theme about patients wanting to keep everything as is was mostly about patients expressing the need to continue activities as they were, keep doing everything they did, and not really wanting to know how it progressed, but just waiting and seeing. So one patient said, but about that head, I don't really worry. That's because I think nothing can be done about it anyway. And another patient said, I still do everything. I still know everything. Odd jobs I do. So yeah, then we don't need to talk about anything. So the third theme about the caregiver wanting to be unburdened was about caregivers wanting to have time away from the care situation and not wanting to decide everything and wanting professionals to also decide some things for them. So one caregiver said, should I tell him not to drive? Well, that means war. I find that's very difficult. Then that admiral nurse came precisely at that moment, and then they said, no, this. So patient behavior, the caregivers described that the patient behavior changed after the diagnosis and with the condition. So they became more inflexible, apathetic, and also inactive. And this really influenced how much burden they perceived, and also it really influenced how much care they wanted to accept. So one caregiver said, he just denies that he has it. He also gets requests from time to time from the admiral nurse, who he has sent packing. She seems to have called him several times now, and he's so angry about that. And then he says, make sure she doesn't call again. So the fifth theme about informal networks, well, in a lot of patient caregiver diets, it became apparent that caregivers and patients who did everything together and who had a strong network did have less care needs, and that if this network was not available, then professional care was more needed. So one patient described it as follows: it's always just the two of us and we arrange it all together so that everyone does help when needed, but yes, that almost never happens either. So our conclusions, patients and informal caregivers, but professional caregivers as well, struggle to construct an image of VCI. And this image is really important to know how to approach the patients and how to get to care needs, actually. And care needs are influenced by patient behavior and the change patient behavior due to the condition, but also by the strength of the informal caregiver networks. And also we found that in appropriate care, the patient really wants to be valued and wants to keep continuing how they do. And the caregivers especially want to be unburdened and not having to decide everything all the time. So in the interviews, it was hinted that solutions for this could be timed interventions, taking non-linearity of VCI into account, but also by resolute professionals who took decisions when the patient or the caregiver wasn't able to. So here's my email address, and thank you for the opportunity to present again.